Preoperative bleeding is a leading indication for blood transfusion amongst patients who are admitted to hospital. We know that in Canada, our blood supply is increasingly constrained, both because of increasing demand as well as declining donor pools, underscoring the need for strategies to reduce transfusion. Tranexamic acid is a well-known medication with an established side effect profile that has been shown to reduce transfusion in cardiac surgery as well as orthopedic surgery. We conducted the TRACTION trial to evaluate whether a hospital policy of tranexamic acid administration can safely reduce transfusion without increasing blood clots.
In the TRACTION trial, we randomized 8,400 patients receiving major non-cardiac surgery to receive tranexamic acid or placebo. The trial demonstrated that tranexamic acid reduced blood transfusion without increasing thrombotic risk. The rate of blood transfusion was 9.8% in those patients who did not receive tranexamic acid, but 7.4% in those who received the drug. The rate of venous blood clots was 2.1% in both arms. Tranexamic acid seemed to be effective without reducing venous thrombosis in all major subgroups that we identified before the trial began. Importantly, approximately 5,000 patients in the trial underwent surgery for oncologic or cancer reasons, and even in those patients, there was no increase in venous blood clots.
So we tested a hospital policy intervention similar to other perioperative practices like antibiotic and VTE prophylaxis. In doing so, we were able to demonstrate that a hospital policy of tranexamic acid or TXA safely reduces red blood cell transfusion without increasing VTE. If TXA were to be broadly used across Canada, we estimate that this would spare approximately 10,000 Canadians exposure to blood transfusions each year. From a health systems perspective, we estimate that this could save greater than 50,000 units of red blood cells each year across Canada and 5 million units of red cells globally. TRACTION also has important implications from a health research perspective. By using novel research methods such as risk-adapted consent and by integrating TRACTION into clinical care, we were able to conduct TRACTION at a fraction of typical costs, essentially demonstrating that high-quality and practice-changing trials can be done effectively and sparing funds for other clinical research that could be done across Canada to improve patient care.
The University of Manitoba managed the TRACTION trial locally and throughout Canada. This was made possible because of Aurora Clinical Research, University of Manitoba's not-for-profit clinical trials organization that really manages clinical trials locally and for investigators throughout our country. The University of Manitoba is a recognized leader in clinical trials and for contributing innovative clinical trial methods that produce impactful results and that improve outcomes for patients and for our health system.